End code. 20-year-old male gunshot wound to the chest. CPR in progress. ETA 10 minutes. It's 8:52. The trauma bay doors swing open, and that's when I meet Roberto. The paramedics are pounding on his chest as he rolls by on the gurney. The team swarms in, taking off his clothes, inserting IVs, and starting blood products. They crack his chest to get to his heart, to assess the single gunshot wound that took his life. They're trying to save his life. I listen intently as rapid fire of orders, assessments, and procedures is being called out. My job is to write it all down as fast as possible. And then I hear it. Time of death, 9:03 a.m. Silence. Just 11 minutes. 11 minutes and my time with Roberto is over. It all stops. The scurrying of shoes, the shouting of orders, the beeping of the machines. Bloody footprints appear on the floor as people retreat away from him. And now I have full view of yet another young body, a life lost for no reason. It's quiet as we prepare him for autopsy and collection of evidence. We are like robots, putting his clothes together, bagging his hands. I am numb. I am numb because Roberto is one of many patients that I've seen lose their life to senseless acts of violence that I don't understand. Roberto's story is not unique. His life is not more important than anyone else who's lost their life from violence. But his story is the story that we use to talk to youth in our community about violence. His story is the reason why I stand here today to tell you that community violence is not only affecting families, it's affecting our community, and it's affecting a nation. Hello, my name is Ashley Farrens, and I'm a violence prevention coordinator at a Level 1 trauma center. I'm the coordinator of our youth violence prevention program called Dusk To Dawn. I'm a nurse, I am a mother, and I'm a community member that cares about the young individuals that are losing their lives. Violence is a problem in the United States, with over 2 million violent injuries recorded, requiring medical attention, with nearly 50,000 deaths every year. Homicide is the leading cause of death for young men aged 15 to 24, and the second leading cause of death for those 10 to 24 nationwide. The devastation that violence imposes on our community is the greatest unaddressed public health issue facing our nation, and our Midwest community is not immune. Over the past 5 years, our trauma hospital has seen 116% increase in victims of violence and a 5% increase for those under the age of 18. Not only are the victims getting younger, so are the perpetrators. We pride ourselves as healthcare providers in saving lives, but in reality, we're patching them up, we're writing them scripts, and we're sending them back to the community that they came from. We are failing our community as healthcare providers. Let me give you an example. There's a community with a water source that's contaminated. Those who drink from that water source are ill, they're sick. They come to the hospital for help. We treat them with medication, we try to make them better. But the reality is that they won't get better until we fix the water and the contamination. We could intervene and give them medications, or we could prevent them from being sick in the first place. Why can't we do the same with violence? Violence is complex. It's been rooted in history for centuries. There is not one size fits all cure for it. Each individual is different. Each individual has their own journey. We are not doing our job. We are not holding to our oath of do no harm until we treat violence like a public health issue and we start preventing individuals from being harmed. Our team started Dusk Till Dawn to meet these young men and women before these bad decisions. We want to see them alive. We don't want them on the gurney. We don't want them in the trauma bay. At the beginning of every class, we ask the students, what are your values? What are your dreams? What are your goals? For some, it's fun. They say things like, oh, I want to be rich. I want to be famous. I want to live in a mansion. For others, I want to go to college. I want to buy my own house. I want to have a family. And then there are the youth that say, I want to get out of the hood. I want to buy my mom a house. I want to stay alive. For some, this path is clear. They understand where they need to go. It's productive. But for others, it's not. There are no choices. Our youth are born innocent, naive, they're happy. What changes them is the environment that we raise them in. They're not angry and violent. But if we don't cradle them in those times of need and stress and chaos, they don't know any different. These atmospheres are toxic. They're destroying what they want to do with their lives. They're destroying their hope, their self-worth. It's an endless cycle that they can't get out of, this contamination of a world. How do we change that? How do we make them know that you are worth more? Your life is worth more than this. They're living in a restricted, deadly area, and it's our job to tell them there is more for you. There is more out there. Dusk Till Dawn is an opportunity for them to know that violence is not the norm. Maybe it's what you were taught in your home, but it's not the only choice. It is our job to step in and say, you are worth more. Your life means more. There's more value to you. In Dusk to Dawn, we ask the students and the youth, what does violence look like to you? The answers I hear are, mom getting beat up, thrown around, shootings in my neighborhood, fights at school. Listen to what they're saying. These youth are struggling to survive. They're struggling every single day. And it is our job to tell them, you can do better. I can see the hopelessness in some of their eyes of trying to get out of that situation. But I also see the determination that they have to stay alive, to protect themselves and protect their families. We know that Dusk Till Dawn is not a bulletproof vest. It is a tool in the toolbox to help them get away from violence. We use a credible messenger in our class. A credible messenger is someone that looks like them, talks like them, someone they can relate to, someone who has same lived experiences, someone who's been in the situation that in a split second you have to decide, am I going to walk away alive? I know that I don't have that experience. I don't know what it means to live and survive the streets. But what I do know is this: life is tough. Life is unfair, and life is too short. I have stood in front of too many families crying over someone that should still be here today, someone who has values, dreams, and goals. Roberto's mom once said, when you are a child who loses your parents, you're called an orphan. When you're a wife who loses a husband, you're called a widow. But there are no words for those who lose their child, because children are not supposed to die before their parents. Children are not supposed to be buried before their parents. They're supposed to bury us. I am a violence prevention coordinator at a Level 1 trauma center because I think every child deserves to know that their life matters. They deserve opportunity. They deserve to live those dreams. It does not matter what zip code you were born into. You determine your destiny. You get to decide what your life looks like. I'm a Robert Wood Johnson Foundation clinical scholar to help change the culture of health of violence in my community. I want every child to know that they get to live their values, their dreams, and their goals. I want to know each one of them longer than 11 minutes. Thank you.